Well, I'm back here again on location at Dr. Raj Sinha's office, Stowe Orthopaedics, here in Rancho Mirage. How are you?
I'm great. How are you?
I'm doing well. Thanks for having us back.
Thanks for coming.
Yeah, we're on your turf this time. Getting me out of the studio.
I'm very comfortable here.
I bet you are. Not as comfortable as I am.
It's a nice chair, huh?
Yeah, speaking of which, what is this chair about?
So typically when you go to a doctor's office and you go into the exam room, you sit on an exam table, it can be hard, a little impersonal. This is our procedure room. This is where we do injections for PRP, stem cells. We do some cosmetic work as well. And so this chair allows people to be reclined, we can put their legs up. It's a little more comfortable chair to be in.
Yeah, this would put me to sleep, and it looks nice.
Yeah,
it's very cool. So speaking of stem cells, let's take a minute to talk about that. What exactly are stem cells?
So stem cells get a lot of discussion, and it's often very confusing to understand what a stem cell is. The most basic stem cell you can think of is the fertilized embryo.
Okay.
Right? That's one cell that's going to become the entire body. So every single tissue, every organ stems from that one stem, that one stem cell. As we grow older, the cells start to differentiate and become different types of cells. But even in adulthood, we still have cells in our body that have the ability to become different types of tissue. So that's basically what a stem cell is.
I see.
The most common locations are in our fat, believe it or not, very readily accessible. Our bone marrow has a lot of stem cells in it as well, which is why when bones break, the blood that rushes in there from the bone marrow is full of cells that start the whole healing process.
It actually kind of makes sense when you think about it.
It does.
Yeah.
The problem was we couldn't harness them before because we couldn't identify them. The other problem is that there aren't a lot of cells there compared to the other types of cells. There aren't a lot of stem cells there compared to other types of cells, and so they can get diluted out.
I see.
Another very common source is from live birth, the amniotic fluid and the amniotic tissue that supports the fetus. That source of cells, they're not exactly stem cells, but they're stem cell-like, and so they have the potential to become other types of tissues.
Wow. So multiple places.
There's a lot of different places you can get them, and the question for us boils down to what's the application, what are we trying to treat, how many cells can we get enough cells to treat a particular problem?
So let's talk about that, because I want to get to this, but how are they treated?
Well, so I said there's three basic sources right now that are readily available. One is from your own fat.
Okay.
So for there you have to have a liposuction, the cells are isolated out from the fat, and then they're re-injected back in.
I see. And that's the most popular?
That is probably the most common right now.
Okay.
That's being done because it's fairly easy to do. It's not very painful. And so this is a centrifuge. This is an example of what you would use to isolate the cells out. You spin them at very high speeds, and because the cells have different densities, they gradient out into different places in the centrifuge tube. You just isolate out the gradient that you're looking for.
Fascinating.
You can do the same thing with bone marrow derived stem cells, and that's probably the biggest source of cells that you can get that are truly stem cells. But it's a painful procedure. It has to be done with some anesthesia, and you have to do it usually in a surgery center to make sure that it's sterile. Similar thing, you get the cells, you centrifuge them out.
These are the things that we see in the movies. It's spin.
That's right. They spin, up to. Well, you can get them up to 3 and 4 Gs.
Oh, wow.
For DNA type of research, those centrifuges will spin that fast. This is only going about 10,000 times per minute, so it's not very
Just 10,000 times, just nothing big. Yeah. So what are the costs, what are the risks? Just try to sum that up for me if you can.
Sure, absolutely. So if you're going to get a procedure like from the fat or from the bone marrow, you're talking about tens of thousands of dollars. Insurance does not typically pay for that, so that's an out-of-pocket expenditure. If you're looking at the amnion-derived cells, which are from live birth, that's much less expensive. It's about $2,000 to $2,500. Again, insurance does not pay for that.
Okay.
And the key is to get the right number of cells. So sometimes you got to do multiple treatments, or you've got to, pay extra to get enough cells to be able to do the treatment. We found that if you supplement the stem cell with platelet-rich plasma from the patient's own blood, it enhances the effect.
Oh, wow. So it's costly, but it's so worth it.
It is in the right application. I mean, I have patients who've got severe arthritis where the bone is degraded. If you think that a stem cell is going to regrow bone and cartilage in that situation, that's wishful thinking. But in early phases, definitely very useful.
Well, I really appreciate you taking the time to put it into layman's for us. 'Cause
Absolutely.
Can be some confusing stuff. Well, thank you so much, Dr. Raj Sinha, for having us here at Star Orthopedic, located on Bob Hope Drive in Rancho Mirage, right by the Gelsons. Tell me, you have a new website. What's the web link?
Yeah, you can go to drrajsinha.com.
There we go. You heard it first. Appreciate having you here. We'll see you after the break.